Hello, and welcome to the Natural PCOS podcast, the podcast dedicated to empowering women with polycystic ovarian syndrome through natural approaches. I'm your host, Dr. Samina Mitha, a naturopathic doctor with a passion for women's health and hormones. Each episode, I'll explore the latest insights and my personal experience to help you manage your PCOS naturally. Together, we'll dive into practical tips, inspiring stories, and the latest research to support your journey towards balance and wellness. Let's get started on your path to thriving with PCOS naturally. Hello, everyone, and welcome back to the Natural PCOS podcast. I'm your host, Dr. Samina Mitha, and today what we're talking about is endometriosis. And, do I have endo or do I have PCOS? These are very common hormonal conditions. And this month is special because it's Endometriosis Awareness Month. So I thought I would talk a little bit about endometriosis and really dive into the differences of these two hormonal conditions, endometriosis and PCOS. Now, what is endometriosis? When we look at, what are the causes? There's actually different theories of what the actual cause is when it comes to endometriosis. We're not 100% certain of the cause, but, there's this really famous theory of retrograde, meaning that the endometrial tissue has actually retrograded through the fallopian tubes and has attached to different areas around the uterus. And before I even talk about this, let's back it up even further is what is endometriosis? The definition is basically, finding endometrial-like tissue outside of the uterus where it typically shouldn't be. That could be around the ovaries, around the uterus, around the digestive tract, and we can even see endometriosis in different areas of the body further away from the reproductive system, which is really interesting. Now, another theory of endometriosis is the stem cell theory, where the stem cells that actually regenerate the lining can actually travel, or, different cells in our bodies can actually morph into this endometrial-like tissue, which is really interesting as well, because it's kind of different from this retrograde cause or theory, I should say. Now, we don't necessarily know for sure what the cause is, but as a naturopathic doctor, what we're looking at is overall, what is this condition telling us? And I think the biggest theme is inflammation, and also the immune system is a big part of endometriosis. Now, the downstream effect of that is hormones get impacted, and hormones can actually make it worse. For example, estrogen. It's not that you have more estrogen when it comes to endometriosis. It just means you might have more in relation to other hormones because of your inability to actually detoxify estrogen. And the more estrogen that's around, it can actually impact the overall system as well. So that's, endometriosis, like the causes. Now, what are the common symptoms of endometriosis? The biggest symptom is pain. If you have really painful periods, these are screening questions that I ask when I'm talking to a woman. Have you ever missed work or school because of your pain during your period? Can you use Tylenol or Advil for period cramps, or does it typically not work for you? Do you have to use maybe something stronger, naproxen, something like that, or does nothing really work? Another big one is there any changes in bowel movement around your periods? Oftentimes we see lots of bowel movement or even diarrhea. Another also flip side of that is we can see constipation as well. So it can be a little bit confusing there, but if you're experiencing diarrhea, that could be another sign. Do you experience nausea or vomiting around your period as well? That's also a big sign that endometriosis could be present. Do you have family history of endometriosis? Because if you have a first relative that has endometriosis, your chances of endometriosis is even higher. For example, your sister, your mom, your aunt, your grandma, anyone like that in your family has endometriosis, has had to take their uterine cell. Maybe they don't have a formal diagnosis, something to consider in that perspective. Another really common symptom of endometriosis is pain during intercourse, or pain in general, like just pain and fatigue throughout the month. Pain where there shouldn't be pain, pelvic pain, cramping, when your period isn't actually supposed to arrive and you're still experiencing pain there. That's another sign endometriosis could be present. So It really takes somebody who can really dive into these symptoms, take it seriously, and then also assess for could it be anything else, a fibroid or any of the other hormonal condition. I think a fibroid is very similar depending on how big the fibroid is. Now, in terms of endometriosis, what we really want to look at too is how have your periods been in the past and how are they now? Is it better on birth control or did it become worse? Because typically when we take birth control, there's a little bit of estrogen in birth control when you're taking combination pill. It depends on the type of birth control, but typically if you get a combination pill and you're worse on the birth control, that could be another sign, because there's more estrogen around in the system. So that can actually impact the body even further. So I hope that gives you an idea of some of the symptoms related to endometriosis. When we compare and contrast endometriosis to PCOS, the biggest symptom of PCOS are these signs of high testosterone, hair loss, acne, and excessive hair growth. This is the pinnacle of PCOS, having those clinical signs and symptoms of high testosterone and or high testosterone in the blood. Irregular cycles. Someone with endometriosis will have pretty regular cycles. Someone who has PCOS might experience pretty irregular cycles. Another thing to also consider is spotting. Sometimes we'll see spotting in endometriosis, and sometimes we'll see spotting in PCOS, but it will last like a long time when it comes to PCOS or just before the period. And in endometriosis, it can kind of just be around that ovulation period where hormones are really changing from what I've seen through my practice. Now, when it comes to PCOS, the cause is typically genetic, which is the same with endometriosis. Insulin resistance is a big cause of PCOS, but one of the biggest things is the pain piece. You can still have pain when you have PCOS. It's more related to the cysts than anything. You could still have painful periods, but if you have painful periods and you have all the signs of endo too, it can be likely that you can actually have both conditions. One didn't cause the other. It's just that these both conditions are coexisting together. So that's like the biggest difference, I would say, when it comes to PCOS is the pain and then also the symptoms of high testosterone. For a diagnosis of endometriosis, right now, one of the major ways of getting diagnosed is through laparoscopic exam. This is a surgery where they go inside to see where the endometrial tissue is and where it's sitting. And for PCOS, a general ultrasound will give us the diagnosis of PCOS. So, endometriosis, that's why it takes a long time for a lot of women to get diagnosed because it involves surgery. Recently, I actually found out about a 3D ultrasound clinic in Hamilton called the Sugo Clinic that does ultrasounds specifically looking at endometriosis. And I think that is a really promising way of checking for endometriosis using ultrasound. So that's an interesting, support because women are waiting so long to get diagnosed here. Now, when we talk about how do we treat these conditions, what's the difference? When it comes to endometriosis, again, the biggest piece of the puzzle is lowering inflammation and supporting the immune system. One of the ways that we can really support the immune system when it comes to endometriosis is making sure that there's no inflammation coming into the system. For example, what I have found is that when a patient goes dairy and gluten-free, we actually notice a significant change in the pain associated with endometriosis around the period. We do have some supplements that have been shown in the research to support endometriosis, especially N-acetylcysteine. This is an antioxidant. And actually, we have a really small study where patients were taking N-acetylcysteine. They were scheduled for a hysterectomy, but few of the patients actually dropped out of the study. I can't remember exactly the number, but they dropped out because their pain improved quite significantly. Supporting the liver's detoxification is really important because that's where estrogen gets detoxified. There's two ways we detoxify estrogen, through our bowels and through our sweat. We want to make sure we're actually moving our body, exercising, and then we want to make sure that we are having daily bowel movements. And also, when it comes to endometriosis, again, we want to support the immune system. Taking antioxidants can be really helpful here. Vitamin E, vitamin D because of its immune system support, but also we know we have vitamin D receptors in the reproductive system. So incredibly important to support with vitamin D in this case. PCOS, the treatments are completely different. I would say almost completely different. I mean, there are times where a patient needs to go dairy and gluten-free depending on their case, and then also supporting them with antioxidants because we know there's a low-grade inflammation present when it comes to PCOS as well. There are definite differences when it comes to PCOS, but what I have found too, and in my personal, quest of balancing hormones is if you have had irregular cycles ever since you had a period, and then you start getting more regular cycles because you start balancing out your PCOS, and then your periods are really bad, and you have all these symptoms that look like endometriosis, you could actually coexist with both conditions. In my specific personal case, I found that when my cycles became pretty regular, there were times where I would have really interesting periods where I would get pretty constipated and would have pain during bowel movements. And I just took that as, okay, maybe I ate maybe too much gluten or dairy this month or something. But I realized that I have been dairy and gluten-free for a very long time. And I just felt better this way. Digestive system, my immune system, all got better when I went dairy and gluten-free. And actually, when I was trying to conceive, I had 2 complex cysts on my left ovary, which they were saying that could be potential endometriomas, but they couldn't confirm, right, through ultrasound. Now, getting this 3D ultrasound, we were actually able to confirm that these are complex cysts that are actually endometriomas. So meaning that I actually have endometriosis as well, which is really interesting because I don't have significant symptoms of endometriosis. But the theory we think is that it's kind of been this low-lying endometriosis, very mild because of all the work I've done to reduce inflammation and support my immune system ever since my early 20s. So, when it comes to endometriosis, it can be varying degrees. There's different stages as well of endometriosis, but it can be very complex and difficult to actually get a diagnosis. But if you have somebody who can really assess for both conditions appropriately and really give you the proper diagnosis, once you know, it can make a world of a difference. Biggest thing what we also see when it comes to endometriosis and PCOS is infertility. Now, one of the biggest differences is you'll see that an AMH, just anti-Mullerian hormone, it might be a little bit lower in someone who has endometriosis, especially if the endometriosis is sitting on and around the ovaries, versus someone with PCOS will have a high level of AMH because they have so many follicles left in that ovary. And one of the ways to really treat infertility, especially with endometriosis, is lowering all that inflammation. But then also sometimes treatment is required because the body just needs that extra support. So I hope this was helpful to really give you a sense of what endometriosis is, what are the causes, what are the symptoms, how it differs from PCOS, how to really treat both conditions and support you along the way. If you have any questions at all about any of these conditions, please let me know, and I'll see you in the next podcast. Bye, everyone. Thank you for tuning in to the Natural PCOS podcast. I hope you found today's episode insightful and empowering. Remember, managing PCOS is a journey, and you're not alone. For resources, tips, and to connect with our community, visit my website at saminamitha.com. You can also find me on Instagram at dr.saminamitha.nd. If you enjoyed this episode, please subscribe, rate, and leave a review. Your feedback helps me to reach more women seeking support for PCOS. Until next time, take care and stay well.